So we're gonna do ostomy care. Just like with any other skills, you introduce yourself and you do the necessary assessment for pain and allergies. And of course, you need to seek the client's permission to perform that skill. Performed hand hygiene, make sure I have on my gloves. Putting up the bed to the comfortable highest position for my sail. With the patient's permission, I am going to now take care of the ostomy bag. Now, the ostomy, for those of you who are not familiar with it, is basically a new method of defecating, okay? It can also be for urination as well, depending on the client's need. But you, as a registered nurse, do need to know what it is and how to effectively and safely take care of this ostomy bag. I want to show you first how to clean the ostomy bag. There's several methods in which nurses clean the bag. One method is to keep this bag in place and then just simply clean it at the bedside, and you would need a basin of sorts. Have your towel and your waterproof pad. Now this method is kind of tricky, but we'll see. You're going to need a syringe with piston, and then I'm going to simply fill it up room temperature water. I'm going to open, and you see these little closures? If you have the client with these type of closures, this is gold. Okay, do not lose it because they're hard to come by. All right. So I'm opening the closure and I'm squeeze out the contents that is within the bag into the basin. You can see how this can be very challenging. And then once the contents are out, as much as possible, I will go ahead and flush in a way that even though I flush, the contents don't splash on me. Okay? That's one way you can do it. And then it goes into the basin. Of course, you would imagine if this was filled with fecal matter that this would be also soiled with fecal matter. Another method is, while this is closed, of course, detach the entire bag from the base. And I'm inspecting what's called the stoma. We'll cover it with like a little towel of sorts in the meantime. And then I will go now to the toilet and then dispose of the contents in the bag on the toilet. I'm over the toilet. Everything is going into the commode. And now my syringe, I will clean from here. I'll simply flush it from here. And I will keep repeating this method until it is clean. Some nurses, you'll see, they will not use a syringe. They'll use the faucet that is over the toilet. You can use that, but just be careful because the faucets come out really strong. Put on a gown and have it in a way where it won't flush over you and you clean the bag. Right. So that is simply cleaning the ostomy bag. In addition to cleaning the ostomy bag, you need to know how to change the entire system if need be. Do so. And when we say the entire system, that includes the wafer and maybe the bag. Now these bags are usually they're reusable, so you don't have to dispose of them. If the integrity of the bag is compromised in some way, shape, or form, of course dispose of it and get a new one. All right? But if it's still intact and you just need to exchange the wafer, then exchange the wafer. Now I'm going to put this to the side for now. And I'm going to use an adhesive remover, okay, to remove the wafer. Now, on an actual skin, you want to be as gentle as possible so as to not irritate the skin. Okay, I'm going to assess the skin. The skin is still intact. I have some adhesive that is stuck on here. I would just simply use an adhesive remover to remove those adhesive from the patient. And then also I'm going to now measure, okay, the stoma to see how big I am going to cut the wafer. And the wafer usually comes like so. This is the wafer, okay? Oh, I guess I'm gonna go with this. I have my pen, and then I'm going to just draw the circle so I know where to cut. I'm going to cut. There's different methods that you will see people use to cut. Use what method you prefer. I just like to cut slits first. You don't have to do that. And then I kind of bend it back. Kind of see if I need to pull back a little more. Okay. And then I'll cut. These scissors are not the best. These are actually the scissors you will see in the hospital setting. That'll be like disposable scissors that you can use. So you may want to have your own. It's up to you. Or use what you have access to. Okay, it fits. I think I need a little bit more on this side. The wafer, you do not want it to be too tight against the stoma, just so it does not restrict circulation, and also so it does not risk jeopardizing the integrity of the skin. And I will ask the client if they prefer to have a skin barrier, which is usually like so, like an adapt, and I will put a light amount over that area. And this is just about right. Okay. So all I'm simply going to do is remove the back adhesive and apply. And then I'll attach. I think this is the one that goes. When you are attaching your ostomy bag, make sure your bag is pointing away from the patient, not like so. That's not cool, okay? And also that the closure is in place. Now you can definitely do the closure after you attach. That's perfectly fine, but you just don't want to leave the patient without ensuring that the closure is in place. You would just simply attach, and you want to hear a clicking sound, or you want to feel and press. Go all the way around, and before you leave, kind of lift up to ensure that it is sealed all around. Okay, because if not, you know, the contents of what's coming out of that stoma is going to leak into the patient, and that is going to jeopardize skin integrity. Put this down so it can facilitate gravity. Cover the patient back up, and you're done.